The research topic I have chosen investigates relationships between age, happiness, and social media use. The main research question I am trying to answer with my research is whether a person's age affects their happiness and social media use. This is a significant problem in today's world because social media is such a huge part of people's everyday lives. One hypothesis I have is that individuals in older age groups use social media less often than those in younger age groups. My second hypothesis is that people who use social media often will be less happy than those who do not use it as often. And my last hypothesis is that the prescription of antidepressants will be higher in younger individuals aged 12 to 25 than in older people aged 35 to 70. Since the internet and social media has been around, numerous studies have been done to investigate the relationships between age, happiness, and social media use. The first study I read regarding the topics of age, happiness, and social media was the journal Similarity Between Perceived Selves on Social Media and Offline and its relationship with psychological well-being in early and late adulthood. This study shows a generational difference in perceived self both online and offline. The experimenters found out that Generation Z may be less depressed and more satisfied with life when they perceive themselves to be different online than they are in real life. This is significant because it shows how different generations perceive themselves and how this contributes to individual happiness. While age determines how social media will affect an individual's happiness, it is important to look at different age groups individually. In a study done in 2022 in the UK, a group of 18 to 23-year-olds were interviewed to collect data on their use of Instagram and their mental health and well-being. The students reported that cyberbullying and judgment from others on Instagram were major contributors to poor mental well-being. This study also mentions that recent studies have proven that more time spent on Instagram is associated with cyberbullying. Another article published by Taskin and Satisi in 2024 notes that spending increased amounts of time on social media increases the risk of being influenced by negative news and content. This article also introduces the term doom scrolling, which is when a person consumes endless negative news online, resulting in poor mental well-being. The authors note that their research indicates that doom scrolling is associated with secondary traumatic stress in social media users, which then leads to poor mental well-being. These articles prove my hypothesis to be correct because the data collected in the studies show that individuals who spend more time on social media are more susceptible to cyberbullying and victimization. I also hypothesize that the prescription of antidepressants will be higher in younger individuals aged 12 to 25 than in older people aged 35 to 70. After reading into it, the opposite of my hypothesis seems to be true. In a study done in 2020, researchers found that patients between 50 and 65 years old suffered from recurrent major depressive disorder more often than younger groups aged 18 to 29, and also had a longer duration of illness. However, the study indicated that younger people develop personality disorders and suffer from drug abuse more often than older generations. The study notes that the differences in symptoms of depression between age groups might be due to age altering some aspects of brain physiology, which could also result in certain depressive symptoms. Although the older population might use social media just as often as the younger generation, they seem to use it for different purposes. In a study done in 2024, researchers found that 66.9% of participants, which consisted of adults 65 and older, used social media to connect with family, such as children, spouses, and other family members. This study also indicates a positive relationship between happiness and social media contact with family members. Another study done in 2024 mentions that older age groups experienced positive emotions from using technology to connect with their strong ties, whereas younger age groups did not. This study found that in the younger generation, friends and coworkers made up most of their social media contact, whereas the older generation is more family oriented. This article determined how social media contact was associated with happiness across different types of family members as well. One interesting fact that the researchers found is that happy men are more likely to have social media contact with family members. As for the hypothesis that people who use social media often will be less happy than people who do not use it as often, the research I have presented today marks this hypothesis as correct. There are numerous articles and experiments that have been done and data that has been collected that shows that individuals who use social media more often are less happy than those who use it less often. Participants for this study consisted of students enrolled in a research methods course at a mid-sized Southern university. There were 60 participants, 30 male and 30 female. The students enrolled in this course range from 18 to 50 years in age. The students are all juniors or seniors in college. Students that participated consisted of traditional and non-traditional students. The materials of my study consisted of two questionnaires. The social media use scale is a questionnaire designed to measure individuals' social media use. The SMUS questionnaire uses a Likert scale, with 1 being never and 5 being very often. The SMUS consists of 22 questions. The second questionnaire I used in my survey was the subjective happiness scale. The SHS consists of 4 questions and also uses a Likert scale that ranges from 1 to 7. It is designed to measure subjective happiness among individuals. Demographic information describing the participants was also recorded. The students enrolled in a research methods course at a mid-sized Southern university were chosen for the study. Students in a research methodology course were given an assignment to participate in the survey and received credit if they did so. There was a link on the class Moodle page to complete the survey. After clicking that link, students were brought to a page where they gave consent to participate in the study. After giving informed consent, the students were taken to the survey. After completing the survey, there was a page that said, "Thank you for completing the survey. You may now exit the page." Every student went through the same procedure. My first hypothesis was that individuals in older age groups use social media less often than those in younger age groups. According to a single factor ANOVA test, the p-value was smaller than 0.05 and allows for rejection of the null hypothesis. And we can conclude that there is a relationship between these two variables. I also created a scatter plot of social media usage scores compared to age, and the results show that the most social media users are aged between 20 and 40 years old. As suggested in previous research conducted by Tomasello et al., social media may gratify family-related needs specific to middle-aged adults than to older adults. This previous study suggests that middle-aged adults probably use social media more often than older adults, and the results of my experiment are consistent with this finding. The second hypothesis I tested was people who use social media often will be less happy than those who do not use it as often. To test this hypothesis, I used a single factor ANOVA test that included social media and happiness. Since the p-value was less than 0.05, I can conclude that there are statistically significant differences among these two groups. As observed by Fumagalli et al., low levels of social media can improve psychological well-being. As seen as in the results from the ANOVA test and the scatter plot, happiness is most closely correlated with social media usage ranging from 2.5 to 4. In other words, too much or too little social media use will not benefit psychological well-being as much as an adequate amount. The third hypothesis I tested using a single factor ANOVA test was the prescription of antidepressants will be higher in younger individuals aged 12 to 25 than in older people aged 35 to 70. Since the p-value of this test was less than 0.05, I can reject the null hypothesis and conclude that the results are statistically significant and show differences among these two groups. As I expected, younger aged individuals answered lower on the happiness scale than older individuals. This is most likely due to higher use of social media. As stated in a previous study by Taskin et al., spending too much time on social media increases the risk of being influenced by negative news and content. My findings fall in line with this previous study because this study used participants aged at about 30 years old, while my data shows that individuals around that age scored the lowest on the happiness scale. This study's strength included representative data, which allowed for the examination of multiple subgroups. However, when interpreting the results of this data, a few limitations must be considered. First, the effect of unobserved co-founders cannot be ruled out entirely when using non-experimental data. Second, the definition of social media remains broad, and my measures rely on the respondents' interpretation of the term social media. Finally, the chosen outcome measure of happiness only captured one aspect of overall well-being. Well-being typically includes multiple other factors besides pleasant emotions, such as scarcity of unpleasant emotions and life satisfaction. When studying the effects of social media use, numerous other measures of well-being could be relevant.